Hey there, it's Dr. Sarah here. On today's podcast, I have the pleasure of chatting with Chelsea and Caitlin from MamaPsychologists. They share their birth stories and tips on how to get through birth trauma. Caitlin and Chelsea are both registered psychologists in Alberta, Canada. They both run private practices, providing virtual support for Alberta-based clients. Together, they created MamaPsychologist, an Instagram page created to provide psychoeducation support to parents everywhere. Caitlin is a mom of 2. She has a little boy who is almost 4 and a little girl who's almost 1. Chelsea is a mom of 1. He was very eager to get into this world and arrived at 27 weeks gestation. Chelsea's beautiful boy just turned 1 this past January. Caitlin shares her story of going through birth during a difficult time in her marriage, and Chelsea shares her experience of having an unexpected preterm birth and life as a NICU parent. Now, before we get started chatting, I wanted to remind you guys that Alicia and I have created a comprehensive online prenatal course. We cover what to expect in the weeks leading up to delivery, including simple things like how to pack your hospital bag. We cover what to expect during the birth experience itself and provide lots of information for preparing for postpartum and how to look after a tiny new human. We also have a section on special circumstances that includes what to expect around preterm birth and what if your baby needs some resuscitation and help breathing after delivery. And believe it or not, we've got a few bonus sections coming up that will include how to prepare as a couple for the transition to life as parents. If you're interested in learning more, head to our website at www.shefoundhealth.ca/masterclass. That's www.shefoundhealth.ca/masterclass. Hope to see you guys there. We'll get into the podcast right after this.
Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, 2 doctor moms who are creating a community rich with high-quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the 4th trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated. Okay, Caitlin and Chelsea, I'm so excited to have you 2 here. I love your Instagram page, MamaPsychologists. I have learned so much and love sharing your content, and I'm really excited to hear about your birth experiences.
Yes, thank you for having us on.
So I know you're both going to share your birth stories, and I don't know if you guys have chatted who wants to go first, Chelsea or Caitlin, but take it away.
Yeah, well, I can start with mine. I have 2, and then I'll let Chelsea lead into hers. Hers is a little bit, there's more to it. So we'll kind of end with that one. She's a hard act to follow, that's for sure. So I had my little guy in March of 2017. The pregnancy was quite rough, I would say. Not physically, but just emotionally. I was going through kind of a lot of changes. There was some marital discord happening. We were actually in this of separating, actually, and going through that. So it was quite traumatic emotionally for me. and we've reconciled and things are good, but it was quite a the most trying period of my life.
Yeah, no kidding.
And I was pregnant, and I'm like, oh my gosh, why is this happening now?
Yeah.
So I really had to work through some things with a therapist and get myself to an okay place where I was taking care of myself and making sure that my basic needs were being met, because I really didn't feel like doing much at all. So kind of towards the end of pregnancy, things had kind of settled down. And then he came at about, I think he was one day late.
Mm-hmm.
So I had no idea what to expect, right? First baby, no clue what in the world I was going to do. So, and my family is in Saskatchewan, a few hours away. So all of a sudden the pain started, and I'm like, is this labor? I have no idea. People say labor is a really bad period cramps. I'm like, oh, I guess, maybe, I don't know. So then called my brother, okay, you got to take me to the hospital. And then I'm waiting. I'm looking at my watch. I'm like, oh my God, he should be, then it's getting more and more intense. And then finally, he's like, I was out of gas. I had to go get gas.
Of course, right? Oh, classic brother move. Yeah.
Yeah. Oh, of course. So then got to the hospital, and I was, I think, 2 centimeters dilated, and then they sent me home. I'm like, oh my God.
I know. I know.
So then as soon as I got to the parking lot, I'm like, oh, it's getting worse. And then for some reason I was craving a strawberry milkshake. So I'm like, okay, we need to go get a strawberry milkshake. And he's like, okay, over. And then we went and got that. And then he decided he had to stop at the grocery store for some coffee. And then he was taking forever. And I'm just sitting in the passenger seat, grabbing the handle, just oh my God. Then he comes back. He's like, oh, I saw so-and-so. I had to talk to them. I'm like, oh my God.
And the car is such an uncomfortable place to labor, right?
Yeah. And you can't lie down.
No.
It's just horrible. So then I get home, and then I hop in the shower. And that was one thing that brought me relief, right?
Good.
And then, the strawberry milkshake came back up.
That's what we always say in labor. You got to like it twice.
I know. I've told my friends that. And one of my friends, she was in labor. She's like, I just kept thinking of you and the strawberry milkshake. I'm like, you're welcome. So back to the hospital we went, and I got the beautiful epidural, I think at 4 or 5 centimeters, and things were I could actually relax then. So I felt okay, and then they had me push. I was 10 centimeters, and then baby's heart rate started going up, and then my temperature started going up. So they said, okay, we need to get him out right away. And then they tried the forceps a couple times. That didn't work. And then all of a sudden there's this team of people in the room, and it went from just 3 people, and then all of a sudden everybody's there. There's a NICU nurse, and then there's a couple other nurses. So it was very, very busy. And then I remember seeing the forceps and being like, oh my God.
Oh yeah.
So that didn't work. And then they put that aside. They tried a vacuum, and I distinctly remember my OB putting the vacuum kind of on his head, and then that didn't work. I remember her throwing it to the side, grabbing another one, and then that was the one that worked. And out he came, and it was wonderful, other than being in an incredible amount of pain, not really knowing what to expect. And this is where my husband and I have discrepancy. He's like, they took you away and they gave you stitches, and they left me there with our baby to feed him. And I'm like, no, I stayed in the room the whole time. He's like, no, you left. I'm like, no, I do not remember that at all.
We don't usually take you away unless you have to go to the operating room. Yeah.
I know. I'm like, I think you're incorrect. He's like, no, I'm not. I'm like, whatever. We'll agree to disagree about that.
Yeah.
So in the hospital for a couple days. He was jaundiced. Breastfeeding was atrocious. It was so hard.
It is so hard, right?
Yeah. And then we were sent home, I think, after three days. And it was hard. And really,
It's intense.
2017, yeah, there really wasn't, like, I'm thinking, okay, was there any like resources out there? Not a lot. Really, there really wasn't a lot out there. I think there was one mental health therapist at our local health clinic that you could see if you scored high on the checklist. But being a psychologist, I'm like, I know what to say, right? I'm like, I'm fine. It'll be okay. I just had this like, okay, I'm just gonna like tough it out. But it would have been like really helpful if I would have had some of the resources, like Instagram, even like all the stuff on Instagram now that is available to kind of understand what postpartum anxiety, what postpartum depression is. It probably would have been a game changer. So I remember, I think it was the second day that I was home with him, and he kind of rolled to the side in his bassinet, and his nose was kind of against the fabric of it. And I just freaked out. I'm like, oh my God, we need to like throw away this bassinet. We need to get something that's clear. Like my husband came home, I was bawling. He's like, what happened? I'm like, we need to get a new bassinet, because I went down the Google road and I was like Googling SIDS and like everything that moms should not do.
I know.
So that was my experience with postpartum anxiety, and it was intense after my first one. But
how long did that last?
It was really tough to say, because we had other variables working through our marriage and the stuff with that, and then here's a new baby.
No kidding. Hey, the biggest stress you could add to a relationship.
We had some really good supports that kind of like helped us through, and I had really good friends, and that really helped us manage some of that. But I remember like the first couple months, it just being like, oh my gosh, like my baby, like he's gonna die of SIDS or something like that. And
me too. That was my obsession.
Yeah. I even bought one of the like Angel Care monitors.
Me too.
You put it under the crib, and then the damn thing, it goes off like all the time if they like slide too far. So it would go off in the middle of the night. I would talk about an anxiety attack. And then finally I was like, okay, at 6 months, I'm like, okay, I don't think we need the Angel Care monitor anymore.
I forgot I had one of those.
Yeah, for my second one, I didn't even like turn it on at all. So it was a big difference for my first to my second in terms of just anxiety levels.
And before we talk about your second, are you able to talk a bit more about your breastfeeding journey and how that went? So you said it was hard in the hospital, which I concur. Breastfeeding is hard for 95% of people have problems with breastfeeding first time.
It was so hard. And I wasn't really comfortable. It's just kind of like weird to begin with. It's like, okay, these are my boobs. Now this little person is going to be eating from my boobs, and they're engorged. And I remember that was really painful as well. And it took such a long time that it just really put me in a state of exhaustion. And it's like, okay, he ate, that took an hour. Okay, now he needs to eat in another hour. I'm just like, oh my God.
And we don't talk about that, right?
Yeah. How like constant it is. And I remember at one point I was pumping, and then we were boiling all the stuff. And I'm like, I don't know how single people do it without a partner. And I just had like such gratitude to them, because that was the hardest thing I'd ever done in my life. So eventually he never really did. It just wasn't pleasant at all. I had some anxiety around it. And he just never really kind of caught on to breastfeeding. So I supplemented him like early on. So then I had issues with my supply, and it just was like,
it goes from there.
Not a good experience overall.
Oh, yeah. I'm sorry to hear that. Yeah. And do you want to tell us about baby number 2?
Baby number 2. Oh gosh. So we were in a much healthier place, a much better place. So she was planned. Pregnancy went quite well. I had more support this time around, knew what was happening. she was kind of like a summer baby. So I think that actually played a part in just making it a little bit easier. Like I was pregnant, like in my later pregnancy in the summer months, which it was hot, but it just seemed almost easier than being pregnant in the dead of winter in Alberta.
Yeah, fair enough.
Hard.
Yeah.
Yeah. And her birth actually went, I don't want to use the term easy, but it was a lot more manageable than my first one. Went to the hospital at 3 p.m. and then she was born at 9 p.m. So I think I was in active labor for maybe 2 hours. It was fast. Yeah.
And did you get an epidural that time as well? Or?
I did. It was glorious.
Oh, me too.
It was
I'm an epidural girl.
Oh my God, the best thing ever. I'm like, I remember thinking at one point, like, oh, we could have another kid. This is easy. But then some of it kind of like wore off towards the bottom. And then she came out and that was incredibly painful. Mm-hmm. And then I'm like, oh my God, I'm never doing this again. She was also, we didn't know her gender. So that was a nice little surprise that we're like, it's a girl. We had no idea that it was going to be a girl. So that was wonderful. The one kind of different experience I had is that like I was shaking a lot, like right after she came out, like my body was just vibrating. Mm-hmm. My knees were shaking, my arms were shaking, and they put her on me. And I just remember feeling like, get her like off. Like I need space. Like I just wanted her off. And then I was like, and I had a little bit of like negative self-talk. Like, no, don't say that. Like she needs to be on you. That's skin. It's really important. But I just distinctly remember being like, I was shaking and I just wanted her off of me. And that's all I wanted. But I kind of sucked it up. And then she started breastfeeding and that went really well. But after talking to a few other people, I guess that experience is quite common that, okay, baby's on you and you're just like, oh my gosh, like I just need some space. I just need to like calm my body down. So that felt a little bit, I don't know if intrusive is the right word, but a little bit overwhelming, I guess, at the time. But all things went really well. Breastfeeding was like night and day with my son and her. Like she latched right away, latched really easily, and we're still breastfeeding. And she's like 16 months old. Nice. So I know, yeah, it's crazy. I had a lot of anxiety about just breastfeeding, obviously, because of my experience before, but it was completely like the opposite experience. So I guess if that's one takeaway, if it went really crappy with one kid, doesn't mean that it could go crappy with the other. So that's one thing that lessened a lot of my anxiety and made, I think, just the postpartum journey just that much easier, I would say.
Well, and it's really interesting because I think that's such a helpful story to share because, if something went poorly the first time, it's so easy to like obsess over thinking that's going to happen again. So to share your experience, which was so different, and who knows why, different. Right?
Yeah, I have no idea why. It's just so interesting. Yeah, how we could be like really struggling and then really successful the next time, and really didn't change too much about myself, but
yeah. Well, and how much like your community and your supports, right? Like it sounds like your relationship was in a different place. Your labor was a little bit more straightforward. Yeah.
Everything was kind of a little bit easier the second time around.
Awesome. That's so good. Thank you for sharing that. And I do want to get back to your birth experiences and how you coped with forceps, but I also want to get Chelsea's experience, and then maybe we can talk about sort of unpacking our birth experiences after you both have shared. Does that sound good?
Absolutely.
Okay.
Yeah.
Sure. I don't even know where to begin. So I had a 27-week, 5-day-old baby. So he was, he was a big surprise. I went into spontaneous preterm labor. We still have no idea why. I'm a preemie, but not that early. So it's just kind of a mystery, and that's what we were told. It's going to remain a mystery. My labor story, I think I was in denial. I remember like feeling some cramping and like a little bit of like discomfort. The day before I felt really nauseous and I was just like, well, I'm pregnant. Like I'm not cleaning the chicken coop. I don't feel good. Like whatever.
Yeah.
And sorry, I live on a farm. That sounded weird if you don't know that. Anyways. And so I was working. I worked through the whole day. And by like 8 p.m., I was like, okay, I guess I need to just call the hospital and see what's going on. Like I'm having, I think Braxton Hicks, I don't know. And they're like, oh, this is really common. You're almost 28 weeks. Like go relax. It should go away. And I was like, it's been all day. And they're like, well, is it painful? And I was like, not really. Like I can manage it. I don't feel like I'm in a lot of pain. So I went, my mom's actually a nurse practitioner. So I went and talked to her and she's like, well, I would kind of say go, but if you don't want to, you don't have to kind of deal. So I went home and I went to bed. And my husband had a headache in the shower, I think, and I woke up and I was just like shaking. I was like, I'm in so much pain. And he's like, we need to go to the hospital. And I was like, no, they're just going to send me away. Like, I'm a new mom. They're going to be like, why are you here for Braxton Hicks? That's ridiculous. He's like, I'll buy you chicken nuggets if you go.
That's amazing.
Okay, I'll go. So we're driving to the hospital at like midnight. We live about 30 minutes out of town. And I'm thinking, this like does not feel good anymore. So we went into labor and delivery and it was beautiful. There was no one there. So I like just walked right in and
Perfect.
she's like, yeah, I was like, she's going to send me home. She's like, I think you're dehydrated. Like, let's see what's going on. So they like strapped me to the monitor and we're like checking everything. And they're like, well, before you go, we better see if like, just check your cervix and make sure they're okay. And I don't remember this, but this is how my husband describes it. He's like, she kind of got really quiet and left the room. And another nurse came in and was like, okay, we're going to just double check, make sure everything's okay. His head's in a weird position. I was like, how do you know where his head is? Like, it's like a weird statement. Like, I don't know what's going on. And then it was just chaos after that. So she's like, you're 5 centimeters dilated. Your baby's coming like tonight. My husband actually, he's me for sharing this, but we laugh about it now. He fainted, like full on, hit the deck on the floor. And so I'm like, oh my God, what's happening? And then I'm like crying and like, it's just chaos. Like they're getting the meg sulfates, like IV set up. They're getting the steroids in, the blood work done. And I'm just like sitting there like, okay. So finally my husband came. Oh yeah. I'm pretty sure I disassociated a little bit. I don't remember a lot of it, but I think I remember it because my husband like talks about it. The experience. And then after that, it was fairly, I guess, straightforward in terms of labor. They tried to slow my labor down. So I got an epidural about 8 centimeters and she's like, you can have one now. And I was like, oh my God, can I? That's the best news today. Like, please, can I have one? And then after that, my blood pressure dropped a bit. So I don't know what he did. I almost fainted and then they got my blood pressure back up and everything was fine. And then, so they wanted to slow my labor down because we live at, our NICU is a level 2 NICU. So we don't actually have a level 3 NICU in our community. It's 2+ hours away. So they're trying to slow my labor down long enough to get the trauma transport team from the NICU to fly down to get my son and fly back up. So I had about 5 people, I think, in the room. And I was also started pushing at shift change. So I think the person that had been supporting me wanted to stay. So I just remember like my doctor, amazing. She was so wonderful. I feel like the birthing itself was not a traumatic experience because of her. But I remember her like looking at me. She's like, don't worry. Like, you're fine. I got you. Don't look at like the 25 people over there.
Oh, you're going to make me cry. Oh, I'm getting all the chills.
Yeah, she was amazing. She's like, it's just me and you. Like, just look at me and you'll be fine. And I was like, okay. Like, I don't know. I remember saying, I didn't make it to my birth class. I don't know what to do.
Right? I know. Yeah.
And she's like, it's fine. You'll figure out how to push. Like, don't worry about it. So that's just how my brain works. I'm like, I didn't research this part yet. Like, But no, I wholeheartedly believe she made the total difference for that part of it. And then, it was like 3 pushes. And she's like, you got to get this baby like out of here so we like can know what's going to happen. And we did delayed cord clamping. So he just kind of laid on the table. Yeah. it was very weird because she was trying to prepare us. She's like, we don't really know what's going to happen or if he's like how he's going to be, what he's going to look like. We don't deliver 27-weekers super often. So she's like, he might cry at all, like it might be super silent. Like, so I was like, well, I've never done this before, so I don't really know what to expect anyways. But she did try to explain what could happen. And so my son was born, 3 pushes. He came out, he was almost 3 pounds, which apparently is chubby.
That is a big baby for 27 weeks. Good job, Mama.
Yeah. My husband's a foot taller than me, so it's his genetics, not mine. But yeah, it was okay that way. And then I think the hard part was I was like super disassociated. Like I don't think I really knew. I remember Caitlin came to visit me because word spread really fast that I had the baby, and we're a pretty tight community. And so they actually ended up like stabilizing him with all the like our pediatric team here in Lethbridge, and then the Calgary pediatric team or neonatal transport team, whatever they're called.
Yeah.
And they actually got him up to Calgary. So I got to see him for about 20 minutes and then he was gone. So I really did not feel like a mom. I was like, everyone, how are you feeling? And I was like, I don't know how I'm feeling. Like, I don't feel like a mom. And they wouldn't, I shouldn't say they wouldn't. I wasn't able to be transferred up with him. So I actually had to stay in the Lethbridge Hospital for a night. And like my husband had to leave me and go up and be with our son.
Oh my gosh.
So that part was really chaotic.
Yeah.
And then the whole Nicu journey is it's a whole other story, but it's a whole big blur. We were there for about 3 months in Calgary, and then in our Lethbridge NICU for about 2 months. And then we ended up coming home on a feeding tube and oxygen and learning all of that. So it was definitely a long journey.
Yeah. And how about breastfeeding? Were you encouraged to start, expressing and pumping right away, or what did they do with that?
Yeah, I started pumping. My supply came in right away. Luckily, I probably had too much supply at the time. I pumped for about 8 months, and then mentally I just could not do it anymore. And
kidding.
I was done, and so I pumped through the whole NICU, and then about 4 months after we came home, and I made the decision to stop. We had a lot of frozen, but because we lived 3 hours away, it didn't last very long because of I think it froze and refroze.
Oh, transporting it, yeah.
So we used it until he wouldn't drink it anymore, and then I switched to formula.
Perfect. And how about postpartum? I mean, the whole NICU experience is another journey to talk about, but how were you sort of in those early postpartum days and, with mood, baby blues, any anxiety or stuff like that?
Yeah, I would say it was more on the blues side of it for sure. I think I cried every day for the first 2 months of the postpartum period, whether that was NICU related or hormones, I have no idea, probably both.
Yeah.
But I remember my doctor was like, do you feel depressed? And I was like, well, yeah, but I don't know if I guess, I can't say I'm depressed as in I feel like it's in a territory that I can't manage it, or I'm in the NICU. How do you separate those two experiences to know?
Yeah.
So for sure, I would say I had some depression, but I actually think it got worse when I got home. It was harder after the NICU. And I think that's when all my postpartum stuff kind of hit me was 5 months later, which isn't unheard of either, but that just happens to be when we got home.
Yeah. Thank you for sharing that story. You made me cry. Just thinking about that connection and that, oh God, birth, right?
Oh.
I feel like there's just something about I identify as a woman, and being a woman and being a mother that just changes you, right? And we have never met in person and we're just talking on Zoom, but I feel connected to you guys because we're sharing our birth stories. And I think it's so valuable for us to share these stories for other people to hear, to know how powerful it is to give birth and that you're not alone in these crazy emotions that we feel post birth and postpartum. Do you guys feel comfortable sharing a little bit about how you unpacked and got through some of the trauma? Because you both had what I would probably consider some traumatizing experiences in your birth. Caitlin, you with the fetal tachycardia is the fancy word for that, right? And having that sort of operative delivery. And then Chelsea, having a 27-weeker in and of itself, right? So I don't know if you guys want to we can just have a casual conversation. You guys let me know how you sort of work through that trauma and give some tips to people in our community who had similar birth experiences.
Yeah, I think for myself, after baby was here, my life was very unstable when I was pregnant. The relationship was up and down. It was such an anxiety provoking time. I wasn't sure if I was going to move back in with my parents, if I was going to get my own place, what that looks like. And I just felt probably a constant 8 out of 10 anxiety all the time. And I'm not sure how much of it was related to pregnancy and how much of it was just life stressors. When baby came, and it's an interesting experience that there was those first couple months where the anxiety was really high, and then it kind of leveled off as things were worked through with therapy and just identifying okay, some of the negative core beliefs, some of the negative coping patterns that I was engaging in, and just the validation of my experience. Oh my God, you have had such a horrible experience. And it makes so much sense that you're feeling anxious, or that you're feeling a little bit of depression, or that you're feeling this way. That anxiety is so justified. And once I kind of understood, okay, you know what? It's not about me. Anybody in that situation would be feeling anxious, and it's okay to feel anxious. And holy shit, I can do hard things, and I can sit with hard emotions, and I can live through hard experiences. It kind of made me realize okay, I am very resilient and strong because I just went through the last 9 months of a shit show.
Right.
Things are okay with me. Yes, I'm anxious. Yes, my mood goes up and down, but I made it through that period of time, and things are going to get better because I do have the support, and I am talking about things. And I kept a lot of things throughout kind of my relationship. There was some shame around it, around kind of what happened. So I wanted I didn't tell very many people, I think Chelsea and another couple of friends, but I felt a lot of shame, and just I didn't want anybody to kind of know what I was going through. So once I started talking a little bit more about it, I did a lot of Brene Brown reading.
Oh my God, I'm just thinking Brene when you're talking about shame, right? Yeah, shame is such a powerful emotion.
Yeah. And I really, kind of leaned into doing some of those readings and acknowledging okay, this is what shame is. It's okay to feel it, but you're still worthy. Just because these bad things happened, it means things can still be okay.
Yeah. Oh, that's wonderful. Thank you for sharing that. Yeah. How about you, Chelsea?
Yeah, I think part of it, in the beginning was just acknowledging, I don't think people would be how are you? And I'll be I'm fine. And I was I'm not. Really, I'm not fine. I'm on day 100 in the hospital. I'm not fine. So I think I just needed to really be honest with that, and acknowledge that it wasn't the typical experience. And I did a lot of my own personal therapy. We talked to the social worker and the psychologist in the NICU, and then I found my own therapist here in Lethbridge and did a lot of that work. And then it's actually around the time Caitlin and I started our Instagram, and it was actually, this sounds weird, but it was super therapeutic for me to talk about some of this stuff and talk about birth trauma and talk about just hard times and being real as a mom. And so that was a really good outlet for me as well. And just connecting with these other women and knowing, hey, you're not really alone, even though you feel really alone. And so that was really good too. And then I've done a ton of training because I'm a little bit of a neuro nerd, I guess. So I like knowing the research behind things, understanding it. So that's actually what inspired me to get certified in perinatal mental health, and just to help moms whose journeys aren't as expected. And that's been super healing for me and really, really helpful. And I also did some EMDR. So it's just Caitlin's trained in it.
Oh, yeah. I movement desensitization reprocessing. Yes, I love it. Yeah,
I'm fascinated by that. Do you?
Yeah.
So Chelsea, you were like a patient or a client of, okay, tell me a bit about that experience.
Yeah, it was super beautiful. Like I know, well, it doesn't sound like I know a lot about it. I don't know a ton about it, but I know some of it. So I kind of knew the process and like what it would be like, but I had a lot of shame and a lot of like my body failed me, or, why didn't I go to the hospital sooner, or why was, all of those questions that naturally would come up. So I did a lot of reprocessing about that and just trying to let that go. And I felt like it was my husband's first child as well, and I felt like I let him down. And so there's just a lot of those like pieces that I needed to really focus on. And I don't want to say let go, because I don't think I've like let it go, but I think just to not carry that as hard as often and have those intrusive thoughts. And it really helped quiet that down, and now I can talk about my birth story and it doesn't feel painful. I can talk about the experience and it's okay. Like it feels in the past, which is where it should be. And so that is it was a really great process for me.
That's great. Yeah. I find, I've had 3 babies, and my second delivery would be considered by many traumatizing because it was similar to you, Caitlin, except it was my second baby, which should just slide right out, right? But I ended up having like, abnormal fetal heart rate, and I had to have forceps, but I, as a like obstetrical care provider, was like, oh, the baby's going to be fine. I'm like, whatever, put him on. Feels like I'm pooping out a watermelon, just get him out. And everyone's like, oh my gosh, that was traumatic. And I was like, oh, it was fine. Because I think like I knew that he would be okay throughout the entire experience. But what I often tell my patients, and I'm curious if you guys think this is good advice, is that I tell them to like feel the emotions, like grieve the vaginal birth you didn't have. It's okay to feel sad. And it's okay to like, I think the important thing is to talk about it, right? Because when we keep it inside, it's not helpful to our brains.
It just stays there. Yeah. And I think it's so important, like you said, what is like considered traumatic to one person, like maybe isn't traumatic to another. They're like, oh, okay, whatever. But what might be considered like a typical birth could actually be very traumatic to that person. Totally. And trauma is so subjective. It's really in the eye of the beholder what trauma is and what it isn't. Yeah. So I think that's a really important distinction, because I think some people may play down their birth stories because it's like, oh, well, like it was like typical, right? Nothing like super traumatic happened. It was like a vaginal delivery, or it was like a C-section, but okay, birth is traumatic. Like it's a physical pain that happens. It's traumatic for the baby, right? They're taken from the womb and like boom, bright lights, to breathe on their own. It's so traumatic for everybody involved. And often that relationship between mom and baby, that it's like, oh, you place them on your chest and it's beautiful. What I had, I'm like, get like baby off. Yeah. I need no, I don't want her right now. I love her, but I don't want her on me right now. So so important to recognize that, I think.
I do too. And I'm really glad you shared that, because I'm sure other people have experienced that. And oftentimes there's shame around that, right? Because you're like, well, I should want this baby. I should, like we should ourselves so much, right? As mothers.
Yes, absolutely.
Yeah. Oh my gosh, you guys, thank you so much. Chelsea, I have to ask, how old is your son now?
He is, oh my gosh, Caitlin, how old is he?
He's born October 29th, right?
So that's 14. Oh, almost 15 months, because his adjusted birthday is in 2 weeks.
Okay. Oh my gosh, that corrected age thing totally confuses me.
It freaks me out, to be quite honest, because I'm like, okay, he's 15 months, but he should be doing what a 12-month-old does, but he does other things, but he could have a window where it's like not quite 12 months. I just don't even look at the baby.
It's very confusing. I know. And how's he doing?
He's doing really good. Actually, he has an ASD, so we're dealing with a hole in his heart, but that's not preemie related. So, which is really hard. So we just found it because he was a preemie. So so far so good. Otherwise,
that's great. And how old are your kids now, Caitlin? 3?
Oh, my boy, he'll be 4 the end of March, and then my girl is 16 months. So
busy.
Yeah, busy. Oh my gosh, so busy.
Yeah. Yeah, awesome. Oh my gosh. Thank you so much, guys, for sharing and being so open. Now, your Instagram is amazing and it's blowing up. So I will link to that below. And then just if you guys can comment how you work with moms and parents and how they can contact you guys.
Yeah. So do you want to go first, Chelsea?
Oh, no, wait, doesn't matter.
Sure, go ahead.
So you can sometimes tell who is posting on Instagram. So I do a lot of like the perinatal kind of postpartum mental health. Caitlin does as well, but that's kind of more my area of focus. And then the birth trauma stuff, but Caitlin's also trained in birth trauma. So we really complement each other well that way. But we do both do like consults, and for anybody in Alberta, we can actually see or support on a one-to-one basis. So they can find us. All of this is on our link tree on our Instagram. And
Awesome.
it's super easy to find. We also answer questions on our Instagram. So we try to do weekly Q&As, or it is just the two of us running it. So we do read every message, and we do try to answer every message as best as we can. So
Thank you.
They can always reach us.
Yeah.
Yeah.
That was really rough. Caitlin, do you want to say that nicer than how I just?
No, that was totally fine. We also have a website, so MamaPsychologists.ca, and then you can find out how to book with us. Or we actually have 3 ebooks, and we have something else that's exciting coming up. We're going to be working with a publisher and hopefully releasing a workbook with postpartum mental health within the next year. So yeah, we're just kind of in the works of finalizing a few things, and
Awesome.
So
that's great.
We're going to be busy.
Yeah, no kidding. Hey, well, I appreciate the time and effort you put in to the work. And I think that so many people use social media to, especially like, oh my gosh, I was on my phone all the time when I was a breastfeeding new mom, right? So to be able to access such reliable content that is so empowering to new moms and so validating to the experiences that we have, I'm beyond grateful for you guys, and really grateful for you being so open and sharing your stories today. So thank you so much.
Thank you so much for having us on.
Total pleasure. Bye, guys.
Bye.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.